Lee Ankrum from the Ankrum Institute here. So I have a class coming, one of the last classes of the first training group, and they are about to do the contents of the thoracic cavity, being the lungs and the heart in the center. So we have the lungs and the heart in the center, and we're about to do this whole thoracic cavity class next week. So what is important about thinking about the contents that's in this thoracic cavity? Well, for one thing I want you to know is that there is, now we know in all my posts and all the videos how important fascia is in the body. So recognize that fascia is inside the entire thoracic cavity. So there is one global piece of fascia that's wrapping around inside the thoracic cavity. Then we have layers of fascia that's also wrapping around the lungs themselves, the heart itself, the other lung. So you have layers and layers of fascia in here. Now what's the important part about the fascia here is that the fascia actually goes down the arms. It is continuous from inside here to all the way down the arms, which is why when you have something happening in the thoracic cavity, you can definitely feel it going and affecting your arms. The other thing we have is the fascia is also connecting into the neck. So we have to realize how continuous this fascia is, both around the organs themselves in the area, but also continues. So we have fascia into the neck, and then fascia actually, of course, going down from in the thoracic cavity. It also goes down. So there is this continuous sort of system that you want to think about when you're thinking about areas of the body. If I only think about an arm as an arm, and I don't think about an arm as part of this whole extension, and it definitely extends through the fascia, then I limit myself in my ability to help somebody with some kind of a pain pattern. So how exciting that the class next week actually gets to learn all about the heart and the lungs and its whole roles that it plays. But I want to give you something to think about in terms of this continuation of the fascia. Thanks, Lee Ankrum here, Ankrum Institute.